At AltaOne Federal Credit Union, banking local means investing in you, investing in your family, investing in your home, investing in your business, investing in your life. Bank local. Bank at AltaOne. To learn more about how we invest in you, stop by your local branch. Call us at 800-433-9727 or visit us online at altaone.org. AltaOne. Investing in you since 1947. Federally insured by NCUA Equal Housing Lender.
Thank you for joining us today. This is Financially Speaking with your host, me, Stephanie Sievers. And this podcast is brought to you by AltaOne Federal Credit Union, the best credit union in Southern California, according to me. So today we'll be discussing a whole host of things from the Unsheltered to how to apply for government benefits and one man's mission to improve growth, which brings me to today's guest and member of AltaOne Federal Credit Union. Welcome, Edward Robinson, aka the Social Servant, based out of Bakersfield. How are you doing today, sir?
Outstanding, Ms. Sievers. Thank you. I'm excited to be here, and I can undoubtedly agree with you that AltaOne Federal Credit Union is the best federal credit union in Southern California.
Love to hear that. Love to hear that. Okay. We talked about unsheltered and the use of that word instead of homelessness. And I really enjoy your story about that when you're talking about how to really think about people's mental welfare too, and really tapping into them. Because the thing is when you think about it from an economic standpoint, unsheltered individuals, they put a strain on local economies, right? They cost, can be associated with all sorts of different things, from managing shelters, healthcare services, law enforcement. It can put strains on municipal budgets. So having the unsheltered individuals, they helping them because they struggle with employment, and then in the economy, we have that loss of productivity and just the additional strain that it puts on welfare and social programs. So I think it's really important to think about all the things that you guys are doing. So really, what inspired you to get involved with this type of outreach and work?
Well, first, I've used to be homeless. When I was a teenager, got into a situation with my family. We had just gotten evicted, but at the time, I was the only one who didn't have a car. So all my friends used to tease me because I didn't have a car. So I actually went on ahead and I quit one of my jobs thinking I'm gonna make room for driver training, and I enrolled in driver training. Little did I know that when I got home from work, all of my family's items were in a U-Haul, and we were moving into an extended stay hotel. So I break the news to my mother, and my mother and my stepfather, we had a battle royale in the house, and I ended up being on the street for all of about 2 weeks. And I was literally homeless at that point. Now, granted, I'm a teenager. I could have just sucked my pride up and apologized. But I remember that it was very important to me to hide that I was on the street. And so I was sleeping in the libraries at the University of Michigan. And the way the campus is set up, you get a book off the shelf, open it in front of you in one of the study rooms. Nobody knows that you're homeless. They can't tell the difference if you're a student or not. And, as a grad student, a social work student at the Diana R. Garland School of Social Work, my colleagues and I, we decided that, maybe there's other individuals who are experiencing the same thing. Maybe they don't even want to receive the help that's available because there's this stigma attached to it, right? the words we use shapes the way we view situations and the stigma that's attached to being homeless. So we decided, well, we're going to start addressing this population that we're providing services to as unsheltered. And we don't want to disrobe these individuals. We just want to actually take a humanitarian approach, identify that, hey, these are actually people that are temporarily unsheltered. Being chronically homeless means that a person is on the street or without a home for longer than 6 months. Most individuals, research shows that most individuals actually are not chronically homeless. They actually come out of the situation. So because of that, we don't want to disrobe these individuals. We actually want to empower them, make them dynamic, and support them through this. So the way that we can do that is by preserving their dignity, identifying that, hey, you're just temporarily unsheltered, and we're here as social servants to serve you, guide you along.
So what are some of the services or resources that you help provide to this unsheltered population?
Primarily, I'm providing hygiene kits and a meal. I used to be in the Army. I did 8 years in the Army. So we provide the meal in the form of a meal ready to eat. Those are like field meals. They come with a heater. Sometimes they got a cookie in them, but we give water and also hygiene, basic hygiene items, socks, soap, towel, toothbrush, toothpaste, comb, brush, right? And a lot of the health conditions and or disparities that the unsheltered population deal with come from the inability to simply perform basic hygiene, right? And that's why COVID was so rampant among this population, and they suffered tremendously. But as a result of that, we determined that the street medicine approach would be the best approach, right? Any healthcare information, it could even be a healthcare brochure, but even the healthcare information that you're giving out is the same as giving a prescription medication out to the unsheltered population because it has the potential to save their lives. So we're giving out the basic hygiene. I'm also making referrals to municipal and government agencies such as CAPK, Community Action Partnership of Kern, maybe even Kern County Department of Human Services for Medi-Cal. I'm also even assisting these individuals with getting their license through Senator Shannon Grove's office or the Kern County Office of Records. I'm helping them with getting their Social Security. As a master level social worker, we specialize in advocacy on a bunch of different levels. Sometimes I even go to a city council meeting and I'm vocal about certain legislative activities that are preparing to take place and how they may negatively impact this population. And so I advocate in a number of ways, but ultimately it's about the outcome, getting the positive outcome. I mean, that's really what even speaking with you today is about. It's about being able to secure self-sufficiency, increase self-sufficiency for these clients who need it the most.
Okay, so what are some of the main challenges you face when working with these individuals who are experiencing maybe this temporary unsheltered situation?
Some of the main challenges are the delayed responses that I'm getting from some of the government agencies. Sometimes it seems that they're so inundated with referrals or that they're so low on staff to actually respond to the referrals that the clients who are supposed to be prioritized actually aren't prioritized. Additionally, it seems like there's an accessibility issue. So what concerns me is that under the Civil Rights Act, these agencies are supposed to go above and beyond to provide care and support to these populations. But as a result, they're really, of the number of referrals they're getting, they're really not able to deliver the information. I mean, if I'm homeless, I don't have an address where I can receive mail. I can't mail you anything. If I'm unsheltered, I don't have a computer. I probably don't have a phone where you can give the call to follow up with on my application. I mean, there's a number of accessibility issues. They have to streamline these systems and make them easier for people who need them to access the services. I mean, this money's earmarked. This government funding for these programs are earmarked. No one's getting a raise or a corner office off of this. So let's just pay it forward. Let's figure out a way that we can track this data and deliver it to those in need. Why is there a delay? And so that's what I'm here to do on behalf of my clients. I'm here to kind of bug the social service offices and say, hey, what's going on? You know, I may even let them use my PO box so that they can retrieve their mail and get their mail. You know, if I'm out on the street going to get lunch and I see someone, I'll say, hey, want to sit down and have some lunch with me? I know this is a fancy place, but you're welcome here too, you know, and make sure that they feel that they're not denied in this setting. So the advocacy is really about empowering these individuals to want to do more, to want to work with me and trust that, hey, I'm on your side. And remember, there's been a number of experiences that have made these individuals not want to trust anyone, want to give up, want to stay on the side of the road in their situation. There's a number of reasons why that's the case, but I'm just happy to support them.
Well, I like what you said about, you're making some really good points. It's if accessibility is the problem, if you have to apply online and then you don't have a computer, how does one apply? Or if you must have a mailing address, well, you're unsheltered. So that's also not an opportunity for you. And then you said you even go out and help people get driver's license. So I didn't even think about that. You know, if you have lost your identification or whatever along the way, you may not even have that, which might preclude you from getting some other kind of services or help that you might need. So it sounds like you have a whole lot going on there. Do you have any success stories or really impactful moments since you've been working with the unsheltered community?
Yes. I can't share too many details, right, but I can. I did have one recently where this person was, so this was a prevention effort. This client was preparing to be unsheltered. And, you know, she just didn't have the money for herself and her kids. She was being evicted and she just wasn't making enough. The place had a number of issues and the landlord just wasn't trying to address them. So at first I was, you know, we had to come up with a strategy. I had to see what she wanted to do. We decided that, you know, going the legal route to keep her to stay in the place would actually be more harmful for her than, you know, trying to identify a new place. So I had to bring her, you know, get her to take some time off, which was difficult for her because she needed every cent she could get. And she comes to my office and I provide housing navigation services where we identify some homes within her price range, within that she liked. And, you know, we sat down, I helped her, we took her over there. And, you know, then she had to come up with the security deposit. She was able to come up with a portion, but she wasn't able to come up with the entire thing. And so as a result of the funding that my program has received, which is for housing and homelessness prevention, I was able to secure that security deposit and on her behalf. And I mean, you want to talk about it, I don't know what that expression is, alligator tears, but you know, she was just so thankful. And it wasn't really about me, right? All these things that we're doing, the marketing and advertising and things that we do, it wasn't really about me. It was about the outcome for this client. The agency or the community that we secured for her, they had heard of my agency and the work that we're doing. So they were very supportive and facilitated this seamless, you know, move in for her. And I wanted to make sure she had boxes and where could she park. And so really these things that she just wasn't even prepared to consider, I made sure I considered and had a checklist written out for her, in addition to securing that security deposit for her. So really what we're doing is empowering her. Now think about this. This is an entire experience. Just think about if you 1 minute facing eviction and you're scared of what the future may hold. Now everything's okay. You can afford to live where you're at, And, you led this whole movement. That's absolutely empowering. All I had to do was just be there to hold a hand a little bit and provide support where it's needed. So it's truly an honor. It's truly an honor. Just like people helped me when I was homeless. I'm happy to pay that forward.
I love that. And I think that's really great. What you're saying is you were able to stop someone from entering that unsheltered situation, which can also come with it a whole host of different things, problems or mental, like how you feel, self-worth and things like that, right? So if you can stop that early on, then you are helping it, you're helping the system and all the system, everything. So is there a place where people can find out what because I think a lot of times it is that, right? You were talking about it earlier. People don't want to tell that they're in that kind of situation, so is there kind of a place like you guys, are there other community organizations to help people who are maybe facing possibly becoming unsheltered or kind of looking ahead and they're feeling that stress of, so are there other organizations that you guys work with and y'all kind of create this ecosystem that people can turn to?
Yes, there are quite a few places that provide that support. The first one, that's probably where most services and resources provided through the county are initiated, is the Community Action Partnership of Kern. Their website is www.211kerncounty.org. And you can receive weatherization assistance. You can receive the food assistance through CalFresh. They also provide senior nutrition as well. They also provide energy assistance through HEAT, which is the Home Energy Assistance Program, which could provide a reduced energy bill. And so there's a number of different resources that are provided through them, but also looking through your government websites, finding the government phone numbers. And there's really 6 main programs that are provided through the federal government, through the United States government. You have the food stamps program, you have Medicaid, which in California, there's a variant, which is called Medi-Cap. And then you have Denti-Cal as well. Then you have the Child Health Insurance and it's the Children's Health Insurance Program. Yes, Child Health Insurance Program. And then you have housing assistance, which depending on your family's level of income, you're eligible or ineligible. And then you have supplemental security income and temporary assistance for needy families, which is TANF. So really viewing the government websites, Department of Human Services, the Kern County Department of Human Services websites will allow you to access all of those supports that are provided.
I love that you mentioned the Community Action Partnership of Kern, right? I never say their whole name. You're saying everybody's whole name, and I appreciate that. I just refer to them as CAPK. So CAPK, but I love them because they are in lots of areas. So it's not just in Bakersfield. I'm out in Ridgecrest. They're also in Ridgecrest. They're in lots of cities. So I do think that's really important that you mentioned them, because they do serve they cast a very wide net.
Mm-hmm.
Okay, so I became aware of you when I was told a story about you renovating a vehicle so that you could take your knowledge and information and everything to the communities that we're talking about, to the areas and the population that we're talking about. You want to tell me a little bit about that?
Yes. Well, actually, it was a project. It was a project for my administrative practice and social work class through Baylor. And as I mentioned earlier, I'm a master's in social work student in the online program. And so the assignment was to find a request for proposal, and you had to follow the rubric of how to properly complete an RFP and fill out each sections. And so, I had done it before, but on a much smaller scale, not one as large as the one that I applied for. And, I followed the rubric and I just zoomed through the assignment. So when I submitted it early, I just asked for feedback from my professor, and she's like, hey, what if you just took the services to the client? And I said, yeah, like a social services office on wheels. And, so she helped me tighten things up, add a little more data in there to substantiate it. And we referred to this practice. This practice is in social work referred to as street medicine, because as I mentioned, providing healthcare information, even so much as a brochure, is the same as a prescription medication for the unsheltered population. But we made it wireless, and because we were going to be providing street medicine, I said, well, if I had an ambulance, that would really fit the whole concept of it being a mobile clinic / social service office. So I literally brought an ambulance. This Mercedes Sprinter, I brought it for $10,000, and it had seats inside, AC working, even has the intercom and the sirens. They all work, but I would never press the button because then I'd be in trouble with the police for running code, but definitely, AC works, so it will provide for confidentiality. I'm able to stock it with hygiene kits and meals. And also it's good for awareness and visibility. And turns out there's only 26 mobile clinics in the state of California to serve the nearly 150,000 unsheltered residents of the state. But we're also the first one in Kern County. So we're the 26th mobile clinic for the unsheltered population in Kern County. And, we received a lot of publicity through the news and whatnot. And it's really allowed me to support the clients. And so that's really the best part. Like I said, I take my clients to, a certain office to get something done, and the workers are well aware of who my agency is and that we're here to assist this individual. And so it's normally we're in and out, and it just kind of allows this tunnel of service, I guess. It allows me to facilitate service seamlessly for these individuals. So that's the entire story. And it is a Mercedes Sprinter. I brought it with 200,000 plus miles on it. So had to put a lot of work into it to get it at in tip-top condition to be safe and compliant. But now it's at 100%. It's at 100%, and so it's like a blessing, that we have this mobile clinic here to serve the needs of this most vulnerable population.
I think that's amazing. It's an awesome story, and you're the only mobile support vehicle for the unsheltered in Kern County, which is amazing, because I actually was reading somewhere, and I don't have that statistic, but I want to say they were counting the unsheltered, and from last year to this year it went up like 20% or something like that. And so, like I said, there's real economic impacts to our communities by having a larger population be unsheltered. Right? Like, it is draining on the economy. So it is really awesome and amazing that you are trying to help combat that by keeping people from actually moving into that category as that unsheltered, and then actually going out and providing services and helping people who are out there who are unsheltered, and you are bringing those services to them. You actually mentioned something about, and we were talking earlier about, sometimes they need computers to do some of this stuff, and that's not readily available if you're unsheltered. And then furthermore, but somewhere in there, you said something about you were making things paper, doing something about, I don't know, you converted some document, it sounded like, or something like that, into some paper versions of things that they could use, and you can help them out that way.
Yeah, yes. And so a lot of applicants, they have to apply for Medi-Cal, or they're not receiving medical assistance because the Medi-Cal system is virtual. So you either have to call in or you have to access it online. And so if an individual doesn't have a phone or access to a computer, they're not going to be able to do that. In addition, you have to verify income. So you have to fax items in, you have to mail items back. So what I do is I allow them to access my PO box. I'll list my PO box on there, my business address, so that I can assist the client and get done what we need to get done, right? And I'll act as their advocate, aka social servant or social worker, right? And then through there, I just go ahead and print out the Medi-Cal application, and we complete it right there out in the field, so that all I have to do now is take it up there and drop it off. And once I get the information back, I see everyone that I assist regularly. I see these guys daily, and honestly, it's to the point now where I know everyone by name. They know me, and I know them. So I see them. I'm like, hey, how you doing? They're like, hey man, yeah, today I just came from the bus stop and it was hot over there. So we just start talking, and and just reminding them that, hey, you're normal. Everything's okay. It's just temporary. I'm here with you in the foxhole, and so I'm happy to be of service in that way.
I love that. Okay, so if you do have access to a computer, how do you roll in Medi-Cal? Like, what is there an enrollment period? Is age? How do you actually do that?
No, the thing about Medi-Cal is that there's certain codes for certain individuals. So if you're medically fragile, or you qualify through income, or you qualify through your situation, you could have a certain immigration status that qualifies you for a certain level of care in Medi-Cal. No one's ever denied Medi-Cal. However, you can receive a share of costs. So based on your income, the level of income that your household is bringing in, then you could get a share of cost of the state. And what that is let's just say that you're making over it, and they say you have a $2,000 share of cost. So that means that you're going to have to pay $2,000 of that bill. And if the bill is $2,001, you're going to have to kick in and pay the additional $1. Or that's when the state kicks in and pays the additional $1. So ultimately, that's what's going on. You're sharing the cost with the state of California, but no one's ever denied. So it's really all about the application, accurately reporting what you have. If you're getting Social Security or some sort of supplemental income, you want to be as forthright as possible about that, as well as any other incomes that you don't have, or expenses that you have, because those things can impact the level of services that you receive.
Okay, so is there any documents or anything specifically you need? If I were going to go online, right, I go to the state website, I guess, and then is there any sort of documents I need to have together or something if I were going to go out and apply for this?
Yeah, they're going to need your social. They're going to need your identification. They're going to need, if you're making income, they may ask for a pay stub. They may ask for a bank statement. But if you don't have those items, if you fall into a protected class status, you can articulate that when they verify or when they follow up, and then they'll continue to move forward, but they'll adjust it. They'll apply a certain code to you. So anyone can access Medi-Cal, though. It's just really income driven. It's based on the income that a household or individual receives.
I got you. And then,
sorry.
No, go ahead.
Oh no, I was just going to say that I think that it's difficult because I guess the United Way of Kern County just released some data, the real cost measure, and they just talked about how 67% of single mothers in Kern County fall below the real cost measure. And so, and also how 62% of households with children under the age of 6 in Kern County fall below the real cost measure. Those are the people who would qualify for Medi-Cal because they fall under that real cost measure. They would be eligible, right? Even though they're bringing in income, because they have those children, the children, they fall into a protected class status, they would be eligible. They would just need to submit that documentation. I also failed to mention that the vehicle is wireless. So I can often pull up in certain settings and provide that service and research these things and do them out in the field or at a person's home. They don't have to come to the location.
Okay. Do you help them apply for any other type of benefits, maybe like Social Security or something like that?
I can do that. I haven't had to yet. I've just helped individuals apply for Social Security cards. I've helped them apply for their licensure or a license, driving license or identification. I've also helped people, pay their taxes. There are clients who have homes and they don't understand about property taxes, or they got a home from their grandmother who's deceased, and now they're trying to figure out what to do with this house because they weren't a homeowner previously, And so I assist in that way too, by getting down to the nitty-gritty and finding the answers for these clients. Okay. So there's different classes of people that need assistance, but although the program that I'm running through Current Health Systems, which is called Engage for Change, change stands for collaboration, health, solid, growth, emerge, that's focused on assisting individuals with housing and homelessness. However, my overall social work practice of the social servant focuses on assisting any protected class members. So those mothers we discussed earlier, people who may, have been low income previously, but now they have a home and they just don't know where to find the resources. I'm more than happy to provide that assistance at no cost.
Oh, that's wonderful. We'll make sure to put your contact information in here so everybody can have access to that. Okay. So you're working, while you're talking about offer things at no cost, how about some advice, right? Do you have any ideas? You've been working with a lot of people on how maybe they can save money or, really reduce their expenses or anything like that, because ultimately that might be some of the things that keep people from going into that unsheltered situation or having to be face that.
Right. And a lot of these tricks didn't come from the School of Social Work. These came from learning the hard way and learning myself, but I'm happy to share them, some of the things that I share with my clients. And this one thing I learned through Dave Ramsey, and he has a book called The Total Money Makeover. And he refers to this method as the debt snowball method. But you begin reducing your debt by starting to pay off your smallest debts, and you use the money that's freed up from paying off that small debt to pay off the debt that's a little bit larger than it. You go all the way until you get to the larger one. So it's growing like a snowball conceptually. And once that money is all freed up, you can begin moving towards your saving goals. So that's called the debt snowball method. But you start with your smallest, working to pay off your smallest debt, and then you work your way up to the largest. I also know about cutting down on the grocery budget through, simply couponing. A lot of people think to themselves, hey, I don't have time to be cutting no coupons, right? But I still cut coupons, and I began doing it in undergrad when I realized how expensive it was to actually eat the things that I like. And so the big thing here is to cut the coupons, and then you have to pay attention to the stores that you're shopping at. Sometimes they have a buy one, get one. Sometimes they have their own separate coupon for the store in addition to a buy one, get one special. So not only are you buying one, getting one free, you're using their coupon. And then if you find a manufacturer's coupon through the Sunday newspaper or coupons.com, then that's going to decrease your spending substantially. Next thing you know, you've gotten everything that you like tripled in your cart for substantially less. So yes, I do still cut coupons. Every Sunday after church, I cut coupons, and I'm pretty happy with the results. I save money, And then there's simple things like simply canceling subscriptions to memberships. A lot of people have these frivolous, movie apps that they don't use, Netflix, Hulu, Spotify, gym memberships. Canceling those things, reviewing those things regularly, really allow you to kind of audit your checking account and the way that the money is being used, right? And not to mention cable costs are increasing, but then remembering to buy generic, really what you're paying for in most cases are the brand name, right? So things like paper, rice and beans, cleaning supplies, right? They cost far less than their marked up competitors, right? Due to the brand name. So that's what you're really paying for, is the brand name. And then the final suggestion that I would have is that you can reduce your energy, well, not the final, but you can reduce your energy costs by simply doing all of your activities that require energy during one time. So if you can take a shower, run the dishwasher, do a load of laundry, all simultaneously, you're actually using less water because it's measuring it by the flow. So when you're using it at that one time, I mean, these things aren't spot on accurate, but you do it all at one time, and you do it during a certain time of day, right? So if you're doing it in the afternoon, or as opposed to the evening where the rates increase, right, you're saving money and still living, right? But also another thing that I learned is getting a large tax refund is actually not a good thing. It means that I need to adjust my withholdings. So, adjusting your withholdings or keeping your money in safe accounts that actually avoid taxation or avoid them from being viewed as your annual income is usually a good route, so that now your annual income is decreased. You get a CD with AltaOne Federal Credit Union, get a CD, or sit it in a savings account or health savings account. I mean, those are really good vehicles for avoiding that annual income and that taxation. So those are just tricks that I learned, through life that have really benefited me when it comes down to taxes.
I love what you said I'm laughing about the beans and rice, because my household eats beans and rice almost weekly. So, we're from the South. So red beans and rice is a thing, and we love that. And so that is a staple in our family's meal budget. And I actually did the whole couponing thing. You're right. People are just throwing them away. You probably can ask people to donate their coupons. They're just money in the garbage. So I think that is some really good points about going out there and doing the couponing and looking at what you're buying and making some changes in your life like that. That's really good. What I didn't think about was the washing and showering and running the dishwasher, all that jazz at the same time, because I have 4 kids. Okay. And so I think it is cheaper if you run it always. It is in the afternoon, right? Like that, instead of waiting at night. So what I'm hearing, which I'm going to take home, is when my kids get home from school and make them jump right in the shower first thing. And then we're going to run the dishwasher and we're going to run the laundry. We're going to do it all at the same time, right when people come home from school, instead of when I'm last minute reminding myself to do it at, 10 at night or 10:30 at night. And then I'm like, I'm trying to take a shower, run the dishwasher, run the laundry and all that jazz. Probably not the best idea. So I'm going to definitely make that tweak in my own personal life. I'm saying I'm going to put all them kids in the shower. I'm like, as soon as you hit the door, take that shower, run dishes when you get home, and start the laundry that's sitting there ready to go.
Yep. So, it's all about the time of day. It's all about the time of day to get that certain rate. Yep.
That is genius. I didn't even think about that. So I love that too.
I think it's anything before 4 is the lower rate, and anything after 4, the rate increases.
Okay, so 4 o'clock is the thing. All right, that's fine. Because I think my kids get home at 3:30. So I'm talking about 30 minutes. And they're gonna be like, no, it's snack time. No, it's not snack time. Snack time's at 4 o'clock. After taking a shower and started the dishes and the laundry.
Yeah.
So that'll be my plan going forward, to share that with them. Okay. So when we're talking about thinking ahead and you're talking about saving money, you did mention Dave Ramsey. I'm a fan of that. But then there's also a bunch of stuff out there on, I do, I'm still working, right? But I also was very curious about Social Security. We won't discuss whether or not I think it'll be around when I go to retire, but in general, if you are getting close to that and you weren't really sure, I did see that out there on the website. You could go to ssa.gov and you can prepare/plan-retirement. So you can go out and actually look at maybe what some of those Social Security benefits might be for you. And actually, I thought it was a pretty good user-friendly, because I don't always know how to do the most tech savvy things. So as we had technical difficulties here today, so that obviously, there we go. But I did check that out and I did enjoy clicking around on there. So if there was anybody that wanted to go and check that out, you can go out there and see about your retirements and whether or not it's a better idea to hold and wait and things like that. So I thought that was really interesting. I'm a transplant to California. So learning about Medi-Cal was new. I didn't know that was an option. That's for California. I didn't know about that.
Yeah, it's really for those medically, those who have a medical need and or who may be fragile. It's really a good tool to just receive the care you need. And the thing that people seem to misunderstand about the shared costs, they view it as a unfair thing, right? Especially when just think about it, when you have a medical need where you're even applying for Medi-Cal. They're like, why do I get a $2,000? Well, you would have paid that anyway to another provider, because they can see these systems are talking, the federal system, wherever you're registered, wherever your income is reported, they're just pulling the income and verifying what you've already reported. So when they're applying the share cost, they're just saying that, hey, this is what you're going to have to pay, and this is what we're going to have to pay, we'll pay after that. That's just like insurance. You would have paid it to, the nursing home or to the hospital, wherever you were, to receive that same level of care. You're just sharing the cost with the state. So that's how I try to conceptualize it to my clients. That, I know it's difficult to understand, but you need the care and you got to be around for your family and loved ones. Normally, when I start talking about the need to support and continue to support your family and loved ones, that's normally just enough to kind of convince, all right, let's move forward with the Medi-Cal application.
Okay, so is Medi-Cal like a replacement then to Medicaid?
Yes, it's a complement. It's California's version of Medicaid.
Okay, so it's not, you don't get to do both. This is just the one.
You can have both. They call that Medi-Medi, and you can get some benefits from the Medi-Cal and the Medicaid, right? And so you can kind of receive a higher level care through Medi-Medi, right? And so that's kind of how that works. You can kind of blend them together. So if you had a share cost over here, then it may be covered by the Medicaid or the Medicare that you have over here.
Okay, I got you. So that is really helpful to know. That way, people don't think that they are limited in their options. If they're thinking, oh, well, I've already got this one, I've exercised all the options that are available to me. In reality, they might not have, and there are other options. So they should really reach out, because your program is mostly funded by grants. Is that correct?
Yes, precisely. Grant funded. And, most social workers work in a hospital setting or for government. Me, I'm private practice. So just to conceptualize, you would look at, you have your primary care physician working in a facility, then you have a surgeon over here, who may do your surgery. Me, I'm a social worker that you can come to for your unique situations, and I'll assist you in different ways, right? I'm not a nonprofit. So that allows me to kind of engage in some of the advocacy efforts that may be legislated. It also allows me to kind of support you without much red tape, right? Because, well, it's my company, and I'm going to continue to document in a manner that's going to be transparent and provide current family health with all the verification they need. But that's ultimately, there's little red tape with the way that I work, and so I think it's very beneficial to clients. It's proven beneficial to the clients so far.
And it's beneficial to our communities, which is really fantastic. So I want to make sure that I get your information out there, because you are a resource for our communities that can help people. And I think that that is really important, that people know how to contact you. So is the website, is that where most people need to go through? Which I loved your website, by the way. I'm going to be honest. This has nothing to do with this. I love your pictures on the website. You got somebody to do some fantastic work for you there. It is beautiful. So if you want to go check it out, that's thesocialservant.com. It's all one word. Is that kind of the best way for people to connect with you?
Yes, people can initiate contact with me through any way. My team, they're all trained and understand confidentiality and HIPAA. So everything that's shared through any method of contact is confidential and protected. Without your consent, I'm violating my code of ethics. So, pretty much you can contact me through the website. You can send a message that way. You can send an email at Edward Robinson, EdwardRobinson at thesocialservant.com. You can call me at 559-791-8885, or you can follow me on Instagram. On Instagram, I am Edward, EDWARD _Sean, SEAN _Robinson, ROBINSON. And, you can follow me for content and or reach out to me that way. And myself or my program manager, one of my staff members, will be in contact with you. And we'll try to figure out if there's a way I can be of assistance. I try to make sure that I manage manage expectations with my clients, so that they know that, hey, we don't always have the answers, but what we do have is the ability to support you and listen and hear the situation and give it a shot, give you something. A lot of times there's eligibility criteria when people are applying for social service situations. And that's really a difficult thing to be rejected as you've come to the realization that you need assistance. That's a really hard pill to swallow. And I've been on the other side of that. So we try to make sure we don't deny anyone. If there's something that I'm unable to do for you, here is a place that can do it. And if you need me to call with you because you don't know, and not everybody speaks the King's English, you may not understand how to speak to a social service worker. You may not understand, this may bring anxiety. You may be neurodivergent and not understand at all what you need to do. Well, I'm here for all of it. Myself, and we're currently training 3 new social servants right now who are just proving that they're going to make an outstanding fit. And then we have our staff, our administrative staff, contracted out to a media consulting group, Myray Media Group, out of LA. And they really just allow us to facilitate this level of support. Their support really allows us, the social servant, to facilitate the support that we provide.
Okay, well, I'm going to wrap it up with the question I'm going to ask you. What can we all do to help in keeping people from becoming unsheltered, or aid in that? It really is beneficial for all of our economies, so we really ought to get involved. So is there anything that we could do, that others could do to help out, or missions like yours, or you guys? But I know that this last year we offered volunteer income tax assistance, right, where we were bringing individuals in, helping them apply for their tax refunds, so that they didn't have to spend a bunch of money to go out and get those refunds back into them. So that's kind of what we tried to do to help out in this, everybody, it takes everybody to work in this ecosystem to help everybody save money. I mean, that's what we're talking about, right? If we can help you save some money or turn your situation around, we want to do that. I'm asking, is there anything else that other people could do to kind of help out with this?
Yes. you can join the social servants efforts in building hygiene kits, as well as working at community events. We're specifically the response to the unsheltered population at various community events. So if there is a movie night in the park, our agency will pull up, and if we see any unsheltered individuals there, those will be the people that we're focused on engaging. So you can support us in that way by shooting us an email or a message and participating in those events, building the hygiene kits. But also, I would encourage you, with your safety posture in mind, of course, to simply engage an individual who may be transient and or unsheltered. Engage them as you and I are engaging, as they're a regular person, and you don't at all notice what they may appear to look like. That does a lot to empower these individuals. And as I mentioned before, socialization and depression is primarily experienced by senior citizens and unsheltered. And 1 in 5 individuals in the state of California is unsheltered. So you can do a lot to actually motivate them towards self-sufficiency by just engaging them in a regular conversation about how their day is going. Oh yeah, you doing all right? What you been up to? You cool out here? You know, just really checking on them, reminding them, hey, somebody cares. People care about you.
Well, thank you for the resources that you also provide our communities, from helping people with their applications, for medical assistance and things like that. And you offer Social Security assistance, helping to fill out like those forms too, because you're right that people might need someone to just hold their hand and walk them through it, feeling like, hey, this is a little unsure about how to do this. Giving people access to any of the county services that are available, and really just making those referrals to those other nonprofits. You guys really appreciate everything that you guys are doing. And so, yeah, thank you, Edward, our social servant, for sharing your story and your knowledge and really your passion with us today. I really appreciated that. Being unsheltered affects people from all walks of life and demographics, from single adults, families with children, young adults, including those that are aging out of foster care, right? Individuals with mental health issues, or those with substance abuse or addictions. And then those who are really personally close to my heart, you are one. So I'm going to thank you to our veterans, right? Thank you so much to our veterans. Some of those individuals end up having difficulty transitioning back into civilian life and might find themselves also facing maybe unsheltered situations. So I really appreciate your work, because you are going out and you're meeting with people, you're helping people before they even before they lose their house or something like that. These are the citizens that are in Kern County, and I applaud you, because you're not really just working with them, but you're really improving the quality of life for our entire communities. So I thank you so much.
Thank you, Ms. Sievers. Thank you, AltaOne Federal Credit. Thank you.
And thank you, everybody who is watching and episode 2 of Financially Speaking, brought to you by AltaOne Federal Credit Union. I'm Stephanie Sievers, and financially speaking, both my head and my heart learned a lot today, and I hope you did too. Thank you.